We got a family problem, apply family systems. In family systems therapy, the pathology is called a cross-generational coalition between the parent and the child. And so that's the correct, instead of parental alienation, it's a cross-generational coalition. In addition, there's just not only the alliance that the child has with this one parent, there's also what's called an emotional cutoff.
Yeah.
The child is cut off from a parent. Yeah. And so the two correct terms are cross-generational coalition causing an emotional cutoff. When we do that, the emotional cutoff, we know where that comes from. It comes from trauma in the parent that's messing with the family and creating all this stuff. So now, not only do we have an attachment pathology, we got a trauma pathology coming through the family.
Yeah.
So we got an attachment trauma. And so those are the type of things where I want to move away from that vague term and anchor us more into science.
Yeah, anchor into science. You were talking about parent-child relationship, and I heard you have a very interesting view about relationships. Can you expand on that?
With relationships, there's 4 types.
Yeah.
Father-son, father-daughter, mother-son, mother-daughter. Mm-hmm. And each one of those is unique. And all of them are equally valuable in terms of child development, equally important in terms of child development. And none of them are expendable. So the father-daughter relationship is not replaceable by the mother-daughter.
Yeah.
It's just a different quality. And so that, in addition, children are from 2 family origins. And they bring together 2 family cultures, 2 family histories, 2 family origins in themselves. So when the child rejects a parent, they're rejecting half of their self-identity as being unable. And so that's where we want to fix things on both sides so that the child can be whole.
Right.
And if you have a difficult parent or a fragile parent, we fix it.
Yeah.
We don't exclude family members. We never do that. If a parent doesn't like a child, they don't kick the child out of the house. And no, we work with them. We fix things.
Yeah. And I guess that is the reason why, if you don't mind referring to parental alienation, why parental alienation is so important and why we need to address this.
There's wonderful research by Ed Tronick out of Harvard called the still face experiments. And it looks like infants and the mom, but it's not really about infants. It's about how the brain works. And so we're seeing the basic structure of attachment bonding in that mother-infant. He has 40 years of research on that. And what's important is what's called a breach and repair. So we'll be talking, and then there'll be a little empathic failure somewhere and a little conflict, and then we negotiate back and fix it again. And that's a breach and repair sequence. And they're totally normal, and it's important that we have these in development because it's like building a muscle of about how to fix things.
Yeah.
So we have breaches, and then we fix them, breach, and it gets stronger and stronger. The thing that we don't want is a breach that's not fixed. Because then the person, the child, never learns how to fix things again. And what happens in their marriage, what happens at work, what happens everywhere when there's a breach. And so when there is a breach like that, and you can see in the still face how devastating it is to the child. Oh, the child is just awful. Yeah. And yet, when we get older, all these kids with the breach, they feel that inside, but we're not seeing it. Oh my gosh, that means all that pain is inside from that and unfixed. And that's the worst thing we can do.
Yeah, we're not seeing it, but we also see that children are in a sort of mindset to say, look, I don't want to have contact with my father, I don't want to see my mother. I mean,
that's what they say.
That's what they say. So
but that's not true.
Exactly, because science is saying something different, as you
just
just explained.
The brain says something different.
Yeah.
The attachment bonding to a parent comes from predators eating the kids.
Right.
So if a kid doesn't bond to a parent, the predator eats them. So over millions of years of evolution, we have a very strong motivation to bond to a parent.
Yeah.
And so I have a child saying, I don't want to be with a parent. Well, the predator's going to... That's not true. The child wants to bond. Oh, but the other parent is messing with them. And what's happening is, with the divorce, that parent is so angry at the other spouse
Right.
that they want revenge on the spouse, and they're using the child as a weapon.
Yeah.
That's more into the domestic violence range. And so I'd say 80, maybe even more of this is about a domestic violence, intimate partner violence, where one spouse is emotionally abusing the other spouse, using the child as a weapon.
And that's strange because children should be a connecting factor. It should not be a bargaining chip. So,
Yeah. And the moment you ask what the child wants, you're making the child a custody prize.
Yeah.
And so each parent then has to influence the child because we're giving value to what the child wants. And so we put the child up and make them fight over the child's opinion. That's the wrong thing.
Yeah.
No. Pull the child out of the middle and make the spouses, it's spouse, but children are off limits. Children are not weapons.
No.
And so we recognize the weaponization of children in Africa or something with the guns and stuff. This is a weaponization of children in the court systems of our countries. And the courts and the psychology people and everything is allowing it. Allowing parents to weaponize their children in the spousal conflict. And it works.
Because, okay, so that's interesting because then we can make the connection to the voice of the child. How should we respond to the voice of the child?
I would say the voice of the authentic child. If I have a prisoner of war, and you put the prisoner of war in front of cameras, and right off camera you have the terrorists or the other people with guns, and America's a bad place, I hate America. Is that the voice of the authentic soldier? Or is that the voice of the coerced soldier? Now, when we have those soldiers making those coerced statements, we all know it's coerced. So why don't we recognize it with the child? When the child is making a parentally coerced statement. So, yes, the voice of the child is valuable, but it's the voice of the authentic child. And what is the voice of the authentic child? Love. What's important to me as a clinical psychologist is not that the child love the parent, it's that the child receives love from both mother and father.
It's one way, is it?
Yeah. And so, that's the important way.
Okay.
And so I want the child to feel loved by dad, feel loved by mom. That's all. Children always want to be loved by mom and dad.
Yeah, of course.
That's normal. So I know the voice of the authentic child.
Yeah.
It's to get mom's love and get mom's dad.
Yeah.
And if there's a problem, we fix it. That's it. Yeah.
It should reflect in our proceedings. Because what do you think about current proceedings with regard to complex divorces?
I like the word complex divorce. I think that's what it is. It's not high conflict divorce. It's just a divorce with a high conflict person in it. So one person's bringing it. And my analogy is to Donald Trump. And if you see Donald Trump, he's a high conflict person. And it's not because everybody is about a high conflict country. We got a high conflict person in a country. And so that's the type of situation. When you get a high conflict person in there, oh my goodness. And so the challenge for the court system right now is trying to identify which parent or what's going on in the family. And so with child rejecting parent, the first consideration is maybe child abuse.
Yeah.
Is that parent abusive of the child? The other possibility is the child being weaponized by this parent. So both factors need to be considered and assessed. Right now, we're not assessing the weaponization of the kid. And so nobody's doing a good... And so, but they're afraid of this other one, and so nobody knows what to do. Because we're using this word parental alienation that has no definition and no scientific basis to it. Once we shift back to science, we can identify which is which.
Yeah.
And so the analogy I use is trauma is like throwing a rock into a lake. You throw it in, there's a rock of the abuse, there's a splash of trauma, and then there's the ripples of trauma through the generations. And what we have to decide is whether this is the rock and the splash, or is it the ripple. And so parental alienation is the ripple of the trauma of a generation before. The rock and the splash was the parent, now it's rippling through. But if we don't understand attachment and trauma and personality pathology and family systems, then we get confused because they look the same.
Yeah.
The ripple has features of the rock in it, and so that's where we need to up the professional knowledge and apply professional. Assessment leads to diagnosis. Diagnosis guides treatment. So it's a very step. So start with assessment. You get, and people say, I don't want to diagnose or I don't want to pathologize. But we have to have a diagnosis to know what the treatment is.
Yeah, of course.
If you go into a physician, they need to know whether it's diabetes or cancer, because there's two different treatments. So we must have a diagnosis. We don't want to stay there too long because it's all treatment. But we do need to diagnose. Be the same from you to me to them. And because here's the problem. Let's say I'm doing an assessment with you, and I have problems with my own mommy. That's going to come into influence how I see your family situation if I have mommy issues. Or if I've divorced my wife, and I see the woman come in, the mother, and she reminds me of my wife. Okay, then I'm getting my stuff into the family. And so anytime we don't structure the assessment, we're allowing room for personal bias to come in. So we have to eliminate. Your assessment has to be the same assessment, and we rely on data. What's the data?
That's interesting. And could it be shaped in the form of a guideline that eventually also legal professionals can use in their assessment?
Guidelines are good, but when it comes to actually diagnosis, I need it even more specific than that. I don't need guidelines as to what your intelligence is. I need specifics. I give you this test and I can compare it to this number and come up with a number that will allow me to make decisions whether you need special education classes or whether you need accelerated classes. I need some way of giving me the numbers that I can make my decisions. And so that's the level of professional work. Now, guidelines we can offer up at the higher levels, and there's nice ways to potentially structure. So when a family comes into the court system, the court refers to clinical psychology, they do assessment, they provide that. And all of that procedural stuff can be structured very well. But the clinical people have to really be structured. Partly because this is going to court. Court relies on evidence, not opinions. Or the opinions are going to have to be based on evidence. So it's getting that ground of that.
I have a very particular question.
Okay.
Is it scientifically responsible that a child has to split its social life? For example, one parent is allowed to move to another city.
So, when children, I want 100 mom love and 100 dad love getting to the child and being received by the child. I don't care whether that's 50-50 or every other weekend. If it's just every other weekend, I still want 100 love. If it's one parent has a school year and the other parent has vacation, well, okay, I just want 100 mom love and 100 dad love whenever the child's with. Now, knowing I want 100 mom love and 100 dad love, and that it's very valuable and everything, from clinical psychology, if you ask me, I'd say 50-50. Because I can't say mom and son are more important than dad and son. They're equally important. So there's no evidence that would allow me to come up with anything other than 50-50. However, there might be a parent who doesn't live in the same school area. So we need to keep the child in one school. So then we give primacy to that parent, and the other parent gets every other weekend. Okay, I can understand that. I can work with that. Sometimes a parent moves 50 miles away, and so we can't do every other weekend. Well, then we give one parent the school year, and we give the other parent the vacation. That's going to make things kind of messy because the school year parent has to deal with homework and all this stuff, but they also get a lot more time. The vacation parent gets wonderful, happy vacation time, but they don't get the day-to-day. So there's good and bad with that, but it's what we got to do. And so the courts can make those decisions. The issue is, for clinical, we just want 100 mom love and 100 dad love whenever they're with each other. There's essentially what we want is family systems therapy, because it's a family problem. So family systems therapy, I would add another therapy called solution-focused therapy. It stays relentlessly on the solution, doesn't go back to the problem. Because this is a trauma pathology that always draws us to the past, it's unsolvable. So it would be solution-focused family therapy is the therapy model for this. Now, on assessment, there's a couple of different approaches you could use. One would be clinical assessment, where I just interview the mom, I interview the dad, I interview the child, I look at mom, child, and the parent together, and then I interview the parents again. And so I'm doing a clinical assessment of symptoms and stuff. That's one model, and I have that in a little booklet form. Another one, though, is if the parent is creating so much pathology in the child that it's messing with the child's life. The child has a fixed and false belief they're being victimized. It's delusion. And if you're producing a delusion in the child, that's child psychological abuse when it's resulting in the loss of a parent. When you weaponize a child, that's psychological abuse. Children are not weapons. And so when a parent is weaponizing a child to that degree, then we need to protectively separate the child while we fix them. Then we restore back again. We always want both parents involved. So the protective separation is just for a short period. Because if I try to change that child and bond, and the other parent is trying to keep the child pathologic, we're going to rip the child apart. So for my treatment period, I need a little zone where we're not ripping the child apart. Right. So we can fix the child, and then we restore again. So that's really goes. Once we identify that one parent, the pathogenic parent, producing pathology in the child, is creating pathology, and we protectively separate, we fix the kid, or we identify it. When the child becomes more pathological, we reduce the time with the alive pathological parent and increase the time with the targeted parent. When the child returns back to normal, then we restore the custody. And so we're responding, it's a contingent visitation based on the child's symptoms. And so that removes the motivation to weaponize the child, because if you weaponize the child, the other parent gets the child. And it's no longer serving your function of retaliating and causing the other spouse all sorts of... And so it's what it's doing is it's interfering with how power assessment is guided by the referral question. If you've got a question, come over to me and I will answer your question. If you've got a question, what should the child's custody be? I can't answer that. That's overbroad. I can't predict the future. There's not enough science. I don't know. If you ask me which parent is causing the child's pathology and what do we do about it, I can answer that. If you don't have that question yet, go ahead and fix things. Put them through skill classes. See if that can, just do the intervention. It's called response to intervention. Just do the low, but if it's not working, these standard stuff that you can predict, and the lower stuff, then you'll need an assessment to find out why isn't this working? Why is this pathology here? Then we kick it up and you kick it into clinical psychology and we produce a diagnosis and move on to treatment. But hopefully, because we know this stuff is coming in, we can do treatment-ish kind of things that will pull a lot of these cases back into normal range. And so it leaves us only with the really tough ones, and then you send them over for assessment. So we don't need to assess everybody. Let's just kind of treat what we think is coming forward, and that'll remove a lot of it. Back into the court because of some sort of child problem thing, pop it out to an assessment. What's going on? Who's causing the child's problem? A child's defying a court order? We should never have a child defying a court order. We need to teach our children respect for parental authority, but certainly respect for court authority. And we have a child coming over, defying it, find out what's going on, send it out to an assessment, which parent's going on, what's happening in this family. Psychology should not be returning issues about custody. They should be telling the court what the pathology is and what unites two cultures, two families, two things within them. That's their identity. And so for the court to say one parent's out of the child's life is destroying the child's identity. Even if the child's saying, I don't want to be, but that's the other parent. And so the court's decision should always be supportive of family. Okay? We should never leave it this way. And so the psychology needs to tell them, what do we do to fix this family? And psychology should deliver for the court. So psychology should be providing the court with information that, so the amicus attorney and the family therapist are a team.
Right.
And so the amicus attorney knows the pathology, knows what it is at the level of, almost at the level of the psychologist. And the family therapist knows the legal, and they can work together.
Are these the unified family courts?
These would be family courts, yeah.
Right, yeah.
And right now we have 2 lawyers for each parent. And sometimes they try to appoint a guardian ad litem or something for the child. That's the wrong focus. It should be on the court. Okay. Because the court has a legitimate interest in the family. It showed up in their court system, family conflict, so now they're involved. And so we get an attorney that can talk with the therapist. Now, if the therapist has something he needs to talk to the court, they have an avenue in. And so that's both parents then still have their legal rights, but the court has an objective third opinion from the therapy to rely on. And so it's those types of changes that focus on bringing family together rather than conflict and all sorts of stuff. So the family court system, because it's family, has to be different than the rest of the adversarial legal system.
Right.
And so that's the little piece of adding that, would just be to add that third mediating in the middle therapy-driven attorney. And what I would ask from those attorneys, if you're going to work family law, is you have to know a little bit about the psychology. So you have to know what the pathology is, what the treatments are. If we work in the legal system, we have to know the legal stuff. If they're going to work with psychology, you need to know the psychology. And I think actually the lawyers who work family law would like that. They would like to be more involved in the treatment components of things and understand that. And people talk a lot about the voice of the child. The voice of the authentic child is my concern, but also that the legal representative represents the treatment. And so that's the healthy side. So the amicus attorney represents the healthy development of the child and speaks that voice to the court and is a mediator from the psychologist to the court.